For more on that measles outbreak, I'm joined now by Kate Tulenko. She's the CEO of Corvus Health, a global health workforce services firm. Kate, thanks for joining us. And Chris touched on some of the issues there, but why has there been such a low immunization rate continuously in the DR Congo?
Okay, the DR Congo's outbreak is very different from the other ones such as Samoa and Ukraine. Those are driven in many cases by anti-vaxxers, whereas in the DRC it's much more driven by the conflict in the country, the low infrastructure. When you look at DRC, it is the size of the U.S. east of the Mississippi, and it only has about 2,000 miles of paved roads. So just the logistics of getting vaccines to people is a real challenge. Plus, there's a great deal of mistrust. There are over 200 tribal groups and linguistic groups in the country, and also rape has been used as a weapon of war, so a great deal of mistrust.
So infrastructure and insecurity. What triggered this outbreak that started a little more than 6 months ago?
Yeah, they're still trying to see what exactly happened. Certainly, you know, the fact that only about 50% of children are immunized against measles was a major factor. They think it may have been brought in from outside the country, or it might just have been the weakening of the health infrastructure due to the Ebola outbreak as well. May have been, you know, the trigger that caused the epidemic. And
speaking of Ebola, I mean, this has now claimed more lives than Ebola.
Yes.
Has it gotten the same attention that Ebola has?
Yes, I don't think it has yet. It's a lot about risk perception. Anti-vaxxers will say that measles is just a regular childhood illness, but when you look at the DRC context, you know, measles is more deadly. It's killed twice the number of people as Ebola, and part of the reason for that is it's extremely infectious, that it's transmitted via droplets and cough, whereas Ebola is transmitted via touching a person.
So it's now reached 26 provinces in the DR Congo. Can it cross borders and oceans easily?
Yes, absolutely. You know, people are often not symptomatic with measles for, you know, up to a week. So someone could very easily contract measles, get on a plane, be anywhere in the world. And I think we're going to see a lot more nations putting in restrictions around measles vaccination. For example, many countries currently require documentation of yellow fever vaccination or polio vaccination. And so I think in the near future we could see a requirement for measles vaccination as well.
What procedures are Congo officials now taking to contain this, to ensure, and also international health officials to ensure it doesn't spread?
Right. So the big thing they're doing is a massive vaccination campaign. This year they vaccinated 18 million people. That's more than the populations of Switzerland and Greece combined, the entire population. So they vaccinated 20% of the population of Congo, and that's a huge effort. And moving forward, I think they'll try to do a better job of the annual vaccination campaigns. Preferably, you want every child to get regular care and to be vaccinated at 1 year of age, but in countries such as DRC, you have to go more with annual campaigns.
So we aren't in the DR Congo. Most of our viewers aren't either, but this has been called the world's worst measles outbreak.
Yes, it is. Yeah.
For those who want to help, what could they do practically?
Yes. Well, on a very personal level, get yourself vaccinated, and on the more global level, donate to groups that help with vaccination campaigns, like UNICEF or Save the Children.
And he mentioned in the report that there is a funding shortage. Is this contributing to an ability to stop this in Congo?
Yeah, absolutely. The ability of the DRC government to collect taxes and to fund itself is somewhat limited, so they don't really have the funds or the staff to do a lot of this work, so they need a lot of help.
Okay, Kate Tulenko there, CEO of Corvus Health. Thank you so much for joining us.
Thank you.